Now, for those of you who joined us last year, you may remember a very special moment. We announced the launch of the Impact4Kids program, created together with the Impact1 team from Stanford Biodesign. It was an exciting milestone for our community. Today, we are delighted to share the results of this first edition, which has already taken place, and we also have some very good news to tell you about what comes next. To present this, we want to welcome Sofia Ferreira, Innovation Manager at San Juan de Deo Barcelona Children's Hospital. Sofia, welcome. The stage is yours.
Well, good morning to everyone. I'm really excited to be here again, 1 year after the big announcement. And we have good news for today. So, well, let's look at what happened in 2024, just 1 year ago in the same room. The Impact1 team and our team, i4Kids, we were so excited to announce a very special collaboration with the Impact1 and ourselves to promote innovation, a transatlantic innovation, because we believe that it's very relevant and very important to connect both ecosystems and to support companies advancing and reducing their risks in their projects with the final outcome of arriving to children. Today, we don't have here with us the Impact1 team. They couldn't join us, but we have a connection, remote connection with Marta. She's gonna explain how was the first year, and we'll give you some highlights of the program.
Thank you, Sofia. We really wish we could be there in person like last year, but we're happy to be joining remotely. My name is Marta Arenas, and I'm an assistant director at Impact1. I'm originally from Barcelona, so this collaboration is really special for me, and it's been great to collaborate with the i4Kids team. Impact1 and i4Kids relationship goes back to 2022, when our teams met in person during the Pediatric Innovation Day in Barcelona. At that time, as Impact1, we had already connected projects to the i4Kids network and vice versa. And by helping innovators and having conversations about their challenges, we realized there was an important unmet need for EU innovators to understand and access the US market and vice versa. So, united by a shared vision to drive innovation and improve patient outcomes, we announced Impact4Kids, a collaboration between Impact1 and i4Kids that brings together the strengths of the US and EU innovation ecosystems. Impact4Kids is a two-way bridge designed to support and accelerate innovation in pediatric and maternal health. And the first edition was carried out as a 6-month online program. The announcement of the program last year felt like a full circle moment, since it was made at the Pediatric Innovation Day, which is the same event where our official collaboration started more than 3 years ago. Since then, we launched and have already completed our first edition, and the objectives of the program were clear. We wanted to promote innovation in pediatrics and maternal health by means of providing training, mentorship, and support to innovators. We also aim to facilitate connections for validation of the need, solution, and implementation strategy, as well as to enhance visibility and access to funding for the selected projects. The call was open for projects focusing on fetal, neonatal, pediatric, or maternal health, including different types of solutions such as medical devices, diagnostics, digital health, or biopharma innovations. To qualify, projects had to be at least at the proof of concept stage and should have not received more than $2 million in total funding. And most importantly, projects had to be passionate about making a transatlantic impact. For our first edition, we received 73 applications, with most of the innovators working on medtech for pediatrics and in a stage between proof of concept and initial clinical trials. In terms of geography, about half of the applications were from the EU and half from the US, which shows that there's a real need for innovators to be connected to both sides of the Atlantic. For the first edition, we selected 6 projects. Avatar MedTech, a company that develops specialized tools that standardize and simplify a surgical technique for reconstructing aortic or pulmonary valves. Bitsby Diagnostics, which introduces the first objective ADHD biomarker based on brain connectivity metrics measured via EEG. SurgeonX, that develops an AI-powered neonatal EEG solution that detects brain injuries in newborns with expert-level accuracy within minutes. Then NoviGuide, which provides an advanced clinical decision support platform that converts medical protocols into dynamic, real-time tools to enhance point-of-care decision-making. PolycoArt innovates with a transcatheter polymeric stent that adapts to arterial growth, promoting vascular remodeling while reducing the need for reinterventions. Angelica Light, which combines a non-invasive wearable brain stimulation device with AI-driven personalization to accelerate improvements in speech, responsiveness, and socialization for autistic children. And as you can see, half of the companies were based in the EU and half in the US, but all of them were interested in understanding and entering the other market. Over the course of 6 months, we helped these 6 companies validate their unmet need, solution development, and overall implementation strategy in the new market. During the program, we offered interactive sessions led by experts and focused on different relevant topics, such as validation of the unmet need, solution and implementation strategy, including IP, regulatory, pricing, and reimbursement. And for all these topics, we provided an overview of both ecosystems, including relevant considerations and differences. Projects receive personalized guidance and connections with key stakeholders to navigate both ecosystems, de-risk their projects, and reduce time to market. We wanted to create a collaborative community where innovators can share experiences, learn from each other, and build lasting connections. And to facilitate their connection to relevant stakeholders in both ecosystems, the selected projects were invited to networking events organized by Impact4 and i4Kids, such as the CEO Summit, which took place in Austin, Texas, or the Pediatric Investment Forum in Barcelona. We asked our participants about the program and how impactful it was for them. And we are pleased to share that we achieved a really high average rating for our first edition. And also, projects believed that this program had a great impact on the development for their project, and most importantly, that they would recommend it to other innovators. One of the aspects that they enjoyed the most was the individual time with our network of experts, and they expressed interest in having even more time dedicated to that. So, given the success of our first edition, we're happy to continue building on that. And we're really excited to share what's next. So, Sophia, I'll hand it over to you for the announcement. Thank you.
So we listened to the feedback. We realized we needed to strengthen the program to dedicate more time to the companies and to generate more impact. And we realized we couldn't do it by ourselves. So we had to look for someone not just to support the project, but also to believe in it. And thanks to the support of an exceptional sponsor, we are able to continue the program with the second edition to generate more impact and to have a deeper program with more dedicated sessions for the projects and hopefully much, much better results. So let me share with you a little bit what's coming next for next year. So as you can see, the second edition, it's based on the core program of the first one, but we're going to have more personalized sessions. So we're going to have one-on-one sessions with all the experts that are part of the program, with the regulatory, market access, IP strategy, etc. We're going to have also sessions dedicated to support the implementation strategies of the companies. And also we're going to be providing an exclusive price for the companies who want to continue working with the experts in a more co-payment model. So what's going to be the timing? So you have to stay tuned. In December, we're going to launch the new call for projects. In January, we're going to be evaluating the proposals. And in February, we're going to start the second edition. It's going to be for 6 months. And I hope that all projects that here are interested in joining our program and that have interest in both a European and the United States ecosystem can apply. I can see some familiar faces here for the first edition. You can just ask them about the program. I'm sure they will give really good and positive feedback. And just before finishing, we'll share with you the team that was involved into the program. You probably know most of the people. They were here last year, and also the Impact One team. And we want to share with you the feedback of some of the projects with their own words, so they can explain a little bit better what their experience was. Thank you very much.
We've just completed the Impact4Kids program, and I'm pleased to say it's been a very worthwhile experience. The combination of deep expertise, practical guidance, and opportunities to connect with people across both the European and US ecosystems made it quite unique. Its exclusive focus on neonatal and pediatric innovation added real value, bringing together people who are deeply committed to improving outcomes for children and families.
This is a really unique program that brings together pediatric innovators and experts who can really help advance those innovations forward. What we took most from this experience was really learning how to communicate our product to diverse stakeholders. It was also wonderful to learn about the broader landscape of pediatric innovations from the other group participants.
This initiative has provided invaluable insights into the pediatric healthcare landscape, with a strong emphasis on translating our technology from the lab to the patients who need it most.
Being part of Impact4Kids was an amazing experience for us. It's the only accelerator that we have joined that truly combines US and European perspective across all the topics that the programs cover, like regulatory strategy, reimbursement, intellectual property, market access, fundraising. So overall, I highly recommend Impact4Kids program for any medical device company or innovator that is working in pediatric innovation.
If you're a startup looking to launch in both the EU and the US, I'd strongly recommend applying. The dual focus is rare and incredibly helpful.
And I, of course, would definitely recommend it to other startups if they want to conquer the US market and to make a technology happen in the US, which is not always easy, but on the other hand, I think it is the main goal of every telemedicine startup.
I would encourage anyone with a pediatric innovation, whether that be in hardware or like ourselves in software, who is trying to help kids. This is a great place to get really actionable feedback about your work.
I highly recommend Impact4Kids to any pediatric projects seeking to navigate the complex path to market with clarity and confidence.
Thank you very much, Sophia, for sharing those exciting updates and great news about the Impact4Kids program.